Nurses in California and Texas are going on strike. National Nurses United. Sorry, we didn't break the indie. Nurses in Texas and Kansas. Slightly. Oh, sorry, it was Kansas, not even California. See that? I was back on last week's stories.
Nurses in Texas Kansas anymore.
I thought not, but nurses in Texas and Kansas moved forward with historic strikes resisting Ascension union busting tactics. So we've got nurses, and we love nurses. Shout out to our wonderful nurses. Delilah Barrios actually was a nurse in Texas. I think she has since left the nursing profession, and it's one of the reasons it's a grind. And what you're going to hear here is one of the reasons why. So 2,000 Ascension nurses started striking on June 27th. It was supposed to be for one day, and it turned out that it wasn't just for one day. But 2,000 Ascension nurses will strike on June 27th for strong contracts to combat healthcare giants' unsafe staffing practices, which we've also been talking about for a long time, but not as much lately. We've been talking about East Palestine and other environmental disasters, but this is also a real crisis, what's going on here with our nurses. So RNs in Texas and Kansas at 3 Ascension hospitals are moving forward with...
Then what?
The what?
Then what did you say? You said not the thing that was written. You Freudian slipped there and said cannabis, but I digress.
Did I really? Come on.
Yes, you did.
No, I think you
absolutely did.
I think you Freudian heard it because your name is Reade.
Can the members in chat? Can the members in chat confirm that I'm not crazy?
Yeah. Type 1 if you heard cannabis. Type 2 if you heard Kansas. Registered nurses.
I think you flubbed one of those.
Nice. Registered nurses in Texas and Kansas at 3 Ascension hospitals are moving forward with historic one-day strikes on Tuesday, June 27th, to protest management's resistance to bargain in good faith with RNs for union contracts that would help correct the endemic staffing crisis, which was announced by NNU and NNOC. All right, driven by their concerns about patient safety, these will be the largest nurse strikes in Texas and Kansas history, which is why I wanted to talk about it.
Yep.
Negatory. See, Gamer says that I did say that, and Desert Mantis says no. So let's see. Somebody's going to have to clip it now. If I did say cannabis, that's great. Texas and cannabis is awesome.
Yeah.
All right.
Yep.
Ascension Management's punitive 3-day lockout of nurses who go on strike has failed to intimidate them, which is what they did after, and they actually did that.
Just rewound. Can confirm it was cannabis.
Nice.
See, I'm not crazy.
I love that you heard that.
That's funny.
Who? Oh yeah, Council of Foreign Relations. Yes,
that's
Dave Bird. 2,000 between the two states. Right. Yes, that is. Yes, 2,000 registered nurses at these 3 hospitals. Correct. There is now even greater momentum and motivation to speak out and demand management and negotiate first contracts with its RNs to improve the health of their patients and communities. Management's retaliatory threats are despicable, but union nurses won't give up our fight. Union nurses won't give up on our fight for our patients, says Chris Fuentes, a registered nurse in the neonatal intensive care unit at Ascension Seton Medical Center in Austin, or Ascension Seton. Ascension's dangerous staffing practices disrupt our ability to provide quality care and put our patients at risk every day. I love hearing that from a nurse. There's a clear sign that Ascension would rather use its vast resources to delay improvement than to invest in the care our patients and our communities deserve with appropriate staffing. So they talk about a timeline of what had happened. And this was some of the stuff about the strikes. The strikes come after Ascension repeatedly dismissed nurses' solutions for patient safety during contract negotiations, including their proposals to enforce safe staffing and improve nurse recruitment and retention. That seems like it helped. So Nicholas Whitehead, who's an RN in the surgery unit at St. Francis Hospital, He says of the hospital chain, Ascension management is shortchanging its nurses and patients. Ascension doesn't pay federal taxes because it's a nonprofit. So while they claim to provide spiritually centered holistic care, nurses' experiences reflect the reality of Ascension's hypocrisy. Wait a minute. They're a nonprofit? Okay, well, let's see what's going on.
We're nonprofit.
We've covered nonprofit
We know how those
hospitals.
work.
We've covered nonprofit hospitals shafting workers before, but not necessarily shafting their executive board. So let's see what's going on here. Ascension's own mission to sustain and improve the health of individuals and communities. Yeah, right. So in the past year, Ascension nurses have made history creating some of the largest private sector nurse unions in states with laws hostile to worker organizing. That's pretty substantial. Driving the surge of unionization at Ascension is the blatant hypocrisy of the nonprofit Catholic hospital chain, one of the nation's largest, that has $19.5 billion in cash reserves, an investment arm that manages $41 billion, and a private equity operation worth $1 billion. $1 billion. A private equity operation from a nonprofit Catholic hospital chain. I don't hear your Catholic. I don't hear your Dr. Evil sounds if you're playing them. Chronic short staffing. Yeah, that was a little low. But chronic short staffing imposed by Ascension Hospital Management, which is a practice that began well before COVID pandemic to boost profits and executive compensation, of course, makes it challenging for nurses to provide the highest quality care to their patients because it drastically limits how much time a nurse can spend on each patient. Short staffing also creates a revolving door of nursing staff who suffer moral injury and distress because they can't provide the care they know results in the best patient outcomes. That's kind of what happened to our friend Delilah. Nurses are patient advocates at the bedside, and when we need to be, on the strike line. And that's an RN in the ICU at St. Joseph's Hospital, Carol Samsel. Union nurses are ready to stand united against these conditions, which are driving away both veteran nurses whom we need to ensure the highest standards of care, but also new graduates who are necessary for the sustainability of our profession. I mean, it's really a crisis. So the latest data from the BLS and National Council of State Boards of Nursing shows that in Texas, Kansas, and across the country, there is no nurse shortage. In fact, in Texas, there are nearly 128,000 RNs with active licenses who are choosing not to work at the bedside, while in Kansas, a much smaller state by population, that number is almost 20,000. Nationwide, there are more than 1 million RNs with active licenses who are choosing not to work at the bedside because of the hospital industry's unsafe working conditions. And more data and information debunking the nurse shortage myth can be found at this link, which you can find at nnu.org, nationalnursesunited.org. We'll put that in the description afterwards. So they're going to talk about just how badly Ascension has been profiteering. So the conditions driving Austin and Wichita nurses to take unprecedented collective action at their hospitals are part of a broader pattern of Ascension negligence and greed. This is really important because nurses don't want to strike. Nurses want to care for patients. The last thing these nurses want to do is go out on strike. Like, this is literally a last resort for them. They feel like they're not being listened to and they literally have no other choice. So not only these actions a direct contradiction to the directives of the U.S. Conference of Catholic Bishops for Catholic Healthcare Organizations, they've garnered the scrutiny of local and national news media and state and federal regulators. So they've got investigations from November 21 and December 22, a couple of them, 2 separate reports in January 23 from Milwaukee. I think that's the one that we showed with disruptions to patient care, long wait times in the emergency rooms, delayed surgeries, staff concerns about patient safety. And remember, there was like one where they had no nurses like for 24 hours because of the handoff in business from one company to the other. There was some kind of a sale or something, and everyone got laid off, and then they had to be rehired, and it was a whole mess. All right. Lawsuits. And a February later to their CEO by Tammy Baldwin called into question their nonprofit status and mission-driven values. Yeah, but they didn't actually do anything about it but a strongly worded letter. And here's where, holy crap, look at how much money this nonprofit is sitting on right now. $19.5 billion cash reserved as of June 2022. That's a year ago. They've only accumulated more money from there. All right. They also got a ton of pandemic money. They're going to talk about that. All right. So at Ascension, Seton, you had 900 represented. And again, you have all their stories right here. 650 at the Christie St. Francis, another 300 at Christie St. Joseph. National Nurses Organizing Committee, and I'm not always the biggest fan of National Nurses United, only because as a union, they already endorsed Joe Biden and Kamala Harris, which I thought was ridiculous that they just rolled over like that. I'm going to call them out on that, but they need help. These nurses need help. NNU has 225,000 members nationwide, which is crazy because if there are 128,000 registered nurses in Texas, how many are there across the whole country? 40,000 in Kansas. That's already 225,000. All right. NNU affiliates also include California Nurses Association, DC, Michigan, Minnesota, and New York State Nurses Associations. So I don't think they represent all nurses, but they're one of the largest unions that do represent nurses. They're vocal. I love that they're standing up for nurses here. Oh, I got to call one other thing out, by the way. Let me go back to this real quick. This picture. What is up? What's wrong with this picture, folks? There's a date. There's a date above it.
Yeah, this is winter. It's like July.
It's like July.
Yeah, they don't look like June.
And what's up with that? Gloves, hat. You could not find any. You could not find any organizing shots from before.
Where was that strike at?
This one, I'm guessing, was in Wisconsin.
Texas?
This is not in Texas.
Well, then maybe.
I'm guessing that this is Wisconsin from the wintertime because they're not wearing hats in June striking. And what's funny is a lot of the nurses' pictures.
Those hospitals are cold. The hospitals are just freezing. That's how it works.
The other thing that I thought that was really funny was it's 2023 and a nurse is wearing a cloth mask. Like, not even a paper, surgical mask. Okay. All right.
Yep.
All right. I thought these are supposed to be the medical professionals. Sorry, folks.
Yep.
Had to call that one out, too. All right. So, that was just funny that I saw that.